Hey everyone, welcome everyone that's on YouTube. We want to welcome you all and thank you all for joining us today. We are excited to get started. My name is Safana Bong Obat. I'm one of the co-directors for FLP. And before you already see some of our wonderful fellows. Today, we will be showcasing the projects that they've worked on throughout the year. And feel free to share your comments and questions during the Q&A session after their presentations. So without further ado, I see that we already have people joining in on YouTube, so we're going to get started. So you guys take it away.
Hi, everyone. We are the National Future Leadership Project Strategy Team 1, and our project topic was focused on alumni engagement and database. So kind of what we'll be talking about today, you'll meet the team, aka us, our purpose for this project goals, our methods, results, and then the findings that we concluded from our study. All right. So starting off the bat, hi everyone, my name is Amira Adeyemi Oladitin. I'm a 2024 Carleton College graduate. A bit about my SNMA leadership, that I am an FLP fellow along with an SNMA Global Health fellow, and I'll also be presenting research at this year's AMEC.
Hi everyone, my name is Ashley Bold. I graduated from Penn State University in 2023, and I'm currently a distinguished postbac scholar at NIH. I was involved with SNMA as an NFLP fellow this year. I was also a speaker last year at AMEC and attended the Region 6 RMEC.
Hi everyone, my name is Linda Wolsu, and I'm currently a second-year medical student at St. George's University School of Medicine. I'm also one of the FLP fellows this year, and I also served at my school's local chapter in various officer positions. And then we also have the privilege of working with our principal investigators, Dr. Felix, Dr. Bigby, and Dr. Washington. And to start off our presentation, we also wanted to mention the SNMA mission statement, which is the Student National Medical Association mission is to improve the quality of healthcare by working to increase the number of culturally competent and socially conscious physicians, while also addressing the needs of underserved communities of color through advocacy and sustainable action.
So our project focuses on alumni engagement and database. And our problem statement is that SNMA relies on the same alumni for events, which causes a limit in diversity and inclusivity. This cycle excludes a lot of alumni and also might create missed opportunities for connection and engagement. And then the people who are asked multiple times to come and show out for SNMA might have burnout if they're frequently involved. And so we based our project question off of the previous alumni engagement survey team. And so what they did was they conducted one-on-one interviews with alumni board of directors. And they found that the structure right now, there's no centralized location for alumni data, that there's outdated contact information for alumni, and there's also a lack of access to the alumni information. From a network standpoint, they found that there's a lack of alumni network. We want to increase this. And so one downfall that we saw is that SNMA seems to reach out to alumni when we need something. And so alumni don't actually know how to get involved. And so we thought, what better way than to go straight to the source and ask alumni and get their feedback in order to learn more about what they think the role of alumni is and compare the perceived benefits to their desired benefits. And so the aim of this project is to design and implement a small-scale SNMA study survey to improve engagement through SNMA. We will collect information for future mentorship and networking opportunities.
Next, we're going to lead into our project goals. So we had 3 goals for this survey, this project that we worked on. Our goal number 1 was to design the alumni engagement survey. So this was developed in order for us to collect key information from SNMA alumni. So we're able to focus on areas such as mentorship interests, professional networking needs, and just overall engagement preferences with our SNMA alumni. Our second goal was to implement survey distribution. So our hope was to collect a small sample size of 10 or more alumni using both text message, email, or social media formats to ensure accessibility and also ease of participation from our alumni. And lastly, our hope was to analyze and utilize the survey insights, meaning that we evaluated our survey responses to identify initial data trends and also use those trends to develop actionable insights so we can inform future strategies for improving alumni engagement within SNMA.
So we have our methods for this project, and our main initiatives was to email the survey to regional directors, and this will allow us to gain our greatest audience while covering all our bases with all the regions. Our second was to create a flyer for social media so that we can reach out to alumni who are not closely affiliated with their specific SNMA chapter or region, and we can also reach out to those involved with NMA since that's a continuation from SNMA. And then lastly, to make sure to help people feel more compelled to actually respond to our survey, we wanted to send personalized text messages. So the questions that we used in our survey was first our demographics, so name, membership, their email, where they went to school. And then we also asked about their residency and what stage of their career they're in, but also too, we wanted to know what topics that they're most interested in at presenting at future SNMA events. So whether that be mentorship or the match or research. And then we also wanted to know if they're interested in currently mentoring any SNMA members and also how they're staying connected with SNMA through social media and what they believe the role of an SNMA alumni person is and how they heard about our survey.
All right, so we're going to show you guys a bit of our results, so the initial data trends that we've collected so far with this survey. Number one, we looked at alumni social media engagement. So with our 17 respondents, which our survey is currently ongoing, we saw that over 40% were able to seem more engaged with SNMA content on Instagram and less so with Facebook, LinkedIn, Twitter, and other sources of forms of social media. Another question that we asked is, what is the role of an SNMA alumni? So respondents answered this question, and it seems to, for a lot of people, the role of an alumni is to be a mentor within the organization and support students. And with that information, we also collected from these alumni future SNMA events, so topics of interest for presentations. We collected this data because we thought it would benefit SNMA in several key ways. So we saw tailored event planning. So being able to understand alumni interests allows SNMA to curate event topics that resonate with its audience, increasing its attendance and engagement. We saw ways that it would enhance professional development. So by identifying high demand areas such as mentorship, research, or the match process, SNMA can focus on providing resources and opportunities that align with members' career goals and being able to enhance and expand our content diversity. So this will help us to ensure a broad range of topics are addressed at various types of events such as AMEC or RMAC or NLP, and applying to various career stages and professional interests within the SNMA community. And this will also overall encourage alumni involvement, so allowing alumni to present on topics that they are passionate about and foster a sense of ownership and involvement within the organization, which will help us strengthen our alumni network. Perfect. So looking at our effective outreach channels, how did you find out about this survey? It looked like 40% found out through text message and 35% through other SNMA alumni, and again, smaller percentages for our regional directors and social media. But it was clear to us that the most responses did come from word of mouth and being able to connect to one another as alumni to alumni, which is helpful so we'll know where to focus our future recruitment efforts. And we'll lead into the discussion.
So this is our progress so far. So this is the flyer that we created to send out to social media and also to our various chapters and regions. And so far we received 17 responses. So if there's anyone in the audience who is currently an alumni member, this link is still accessible and you can fill out the form if you feel so compelled. And we are currently still in the process of getting this flyer distributed onto the social media platforms of both SNMA and NMA.
So as we pass the torch to next year's Alumni Engagement Strategy Team, we came up with some recommendations for future projects. Number one would be to establish an exit survey. This would serve as a clear indication to members that they are now considered alumni. And this would also allow us to establish a list of benefits so that they don't have to rely on their perceived benefits of what an alumni is. We could also create a group messenger for alumni to join near the end of their 4th year of medical school so they can stay up to date. And then for another recommendation, we can improve data analysis by having the next team conduct follow-up interviews with SNMA who present at panels or related conferences to gather qualitative insights for their engagement. Next, the next team can increase outreach sustainability by identifying the most effective outreach methods based on the research that we did and personalized communications to encourage participation. Lastly, they could create an alumni database, and this would be really insightful for SNMA as a whole. If they utilize Instagram, which we saw was 40% of how alumni get information from us, they can contact them and try to get some of their contact information to build this database up. It will be a central location for all alumni contact information. It'll be accessible by all officers, and the next team can determine who will maintain it, such as the national staff. We want to give a special thanks to our FLP coordinators, Tamika and Safan, and our principal investigators, Dr. Gabriel Felix, Dr. Brittany Hazard-Bigby, and Dr. Kristen Washington. We're open for any questions.
Excellent, excellent. Yeah, wonderful presentation. Thank you all. Strategy team number 1. We will now open up for a 2-minute Q&A from any of those viewing on Facebook, on YouTube, to ask any questions you have for our fellows. I think one question we have for you all, if you're willing to answer, what is one aspect of this project that seemed particularly difficult, and what were some ways that you each navigated that? You each can, share your own perspective on that.
Yeah, to start us off, I would say one way, at least one challenge we face when working on this project is collecting respondents. I feel like whenever you have a survey, it's hard to reach out to people because people get surveys all the time to fill out. So we really tried our hardest to figure out ways to connect with other SNMA alumni. So through our PIs, through NMA, through other various forms of social media, and just kept kind of like hacking away at trying to get more than 10 plus alumni to fill out our survey. So I feel like that was a challenge for us.
I think another challenge was also like figuring out which questions to ask, because we had to change it in between when we initially sent out the survey. So just making sure the questions are clear to not only the alumni but also relevant in what information we were trying to obtain.
Yep, I agree with both of those.
Wonderful. What are your kind of, beyond the expectations you have for continuing on this project, were there any specific expectations you had for the next group that you hope to take over for you?
I think really creating that alumni database would be very helpful because we have some of the data to know how to reach out to the alumni. If we just go ahead and just try to do it and try to create that database, it will be really effective. And really targeting those 4th year medical students so that they, as they exit from SNMA, they automatically will be involved as alumni instead of trying to reach out and find alumni that, may or may not be involved anymore.
Nice. We have a question from YouTube from C. Thompson. What was a success you saw through this project that made you proud?
I think seeing like people's eagerness to fill out the survey was really nice. Like I wasn't really expecting like people that are, I guess, big in the SNMA community to be able to fill out the survey. So it's kind of nice actually seeing that your work is actually making sustainable progress. It was really nice to see.
Mm-hmm. Excellent. Do you have any closing? And yeah, I think those are all the questions we have so far for you. But do you have any closing remarks for us before I let you guys go?
I think we would just like to say again, extend our thanks for being a part of the FLP group, this cohort this year. And it was really great. I just had a really great time working with Linda and Ashley. So I'm excited to see what the next strategy team for the next cohort does with this project in order to expand.
Thank you all so much. And then we'll have strategy team 2 come up. Let's see. And let's see. Okay, excellent. And then, okay, strategy team 2, take it away.
All right. Hi, everyone. We are with Strategy 2 team, and our project is focused on enhancing SNMA transition document. So today we'll just talk about the importance of this project, the project goals, our proposed solution, which is a transition document that we created. So meet the team.
Greetings, I am Raina Hobson, a graduating health science pre-medicine and business administration double scholar at Florida A&M University.
Good afternoon, everyone. My name is Jules Cadovo. I'm a double major biology and health policy, fourth-year student at the University of Rochester on the pre-medical track.
Hi, everyone. This is Chineye. I am a postgrad student and graduated at Wright State University. And this is our amazing consultants, Dr. Chikura, Dr. Moore, and Dr. Michael Jr. So the SNMA mission is to improve the quality of healthcare by working to increase the number of culturally competent and socially conscious physicians, while also addressing the needs for underserved communities of color through advocacy and sustainable action. Our project purpose is aimed to standardize a transition document which will enhance data accessibility and knowledge transfer across SNMA regions. The problem was SNMA currently lacks a centralized standardized document that manages transitions across regional committees, which could lead to inconsistency in data accessibility and also knowledge transfer. So our goal for this project, which we've been working on, is to design and implement a transition document which improves and has a standardized form that all SNMA regions can use during the transition process. So we broke this down into 3 main initiatives. We got information from all the regions from their current transition document, and we used that to create a compiled transition document. And our proposed advice for the next FLP fellows is to create a survey to regional leaders and get feedback on the document that we just created. And our solution was, this is the transition document and the outline of how it looks. So I'll start with what the introduction is. Article 1 is focused on explaining what the transition document is and the importance of it, which is to minimize disruptions, maintain trust among members that are transitioning, and produce a more sustainable process. Article 2 is our general guidelines, which is focused on transparency and why open communication is important, having documentations throughout each region, accessibility of all the documents, passwords, all things that are important, and obviously feedback from outgoing leaders and oncoming leaders. And Article 3 is regional leadership roles. So this goes in depth into defining leadership roles, ensuring that there's consistency in transition document, clarifying the frameworks, and also which supports collaboration.
So Article 4 discusses the regional elections, and before the conferences, we notify candidates, collect documents, promote positions, and establish an election committee. During the conferences, elections are conducted fairly to use a blind ballot system with succession guidelines in place for vacancies. Key takeaways from this section is stick to the election timeline, ensure candidate eligibility, and reinforce commitment through the oath of ceremony. Article 5 is about the transition timeline. It helps explain a smooth transition prevents leadership, financial, and project disruptions while ensuring initiatives and outreach continue. To apply this, assign a regional transition lead and require outgoing leaders to complete a transition document covering goals, financials, key contacts, and system access. Standardizing this process strengthens communication and ensures long-term success. Continuing about Article 5, this slide shows that a successful transition depends on a clear responsibility list. The RD oversees the processes, ARDs facilitate handovers, and the treasurer and secretary manage financials and documentations. The parliamentarian ensures constitutional compliance while outgoing officers complete transition documents and incoming officers actively engage in the processes. And then this is just a breakdown of the months when it comes to the transition timeline. Month 1 is the preparation phase. The RD schedules the transition meeting, outgoing officers complete transition documents, and the parliamentarian reviews governing documents. Month 2 is the knowledge transfer phase. ARDs facilitate one-on-one handovers, outgoing officers train and shadow new officers, and the treasurer completes financial transitions. Month 3 is the implementation phase. Incoming officers hold their first meeting, outgoing officers provide support for 30 days, and the final transition review ensures a smooth handover.
Right. So some discrepancies that we notice is across the regions is that there's a lack of a formalized transition role. So this leaves it sometimes onto the former president to establish the transition for all positions. This creates a problem because without a standardized transition process, the effectiveness of leadership handovers varies across regions, leading to knowledge gaps. And our sort of solution for that was to sort of enhance the training for incoming leaders. And we're doing that by having comprehensive orientations, mentorship opportunities, and interactive workshops so that incoming leaders can practice what they can do. And then we provided a comprehensive examples and templates for regions that sort of lack a functional model, ensuring that they have a solid framework to reference. By showcasing well-established models, we offer a clear roadmap for implementation, facilitating a smoother and more efficient transition process. As you can see here, I provided various links that I will be showing you guys right now of various templates that we have, various transition checklists that they can use. Next slide, please. All right, so the overall goal of this was to have like centralized access, standardized format for all regions, and it also allows for regular updates as well. Next slide, please. So here's a template of our expense report template that we created. The whole entire theme was just transparency, simplicity, and accountability. Each regions kind of have different things that they have going on, so we just made each template as simple as possible so that they can just use it regardless of whatever it is that they have going on in that region. Next slide, please. So here's a template of our project sign-off. All right, again, it's simple and cut and dry. This allows for risk mitigation. It helps prevent disputes by documenting approvals and ensuring like all parties acknowledge the final deliveries, and also improves performance as well, because it serves as a good reference and access point that you could look back at. And then final template that we included was a template for like any knowledge transfer that might need to occur. This helps capture essential information, strategies, and best practices so that new leaders can seamlessly continue initiatives that are taking place. All right, so We just kind of explained each of the various parts of our transition document. And again, our goal with that was to establish clear guidelines, create a centralized template, and incorporate feedback mechanisms that each region can use. Next slide. And if anybody wants to see how our transition document looks like, here's a link with the QR code.
So we wanted to
Okay.
make a visual aid of the transition timeline. So week 1 through 2 is evaluation of the outgoing term. Week 3 is preparation of key documents and resources. Week 4 through 5, schedule handoff meetings. Week 6, introduction to key stakeholders. Week 7 through 8, full assumption of roles by the incoming leaders. Week 9, review and adjust of transition effectiveness. And week 10 is the final transition review meeting. As we transition into the next FLP fellows, we made a suggested survey for them to send out and to receive feedback on the transition document we showed in the previous slides, to see what edits and additions can be made. And this will allow an opportunity for a constant transition document across all regions with all required information. And we just have a couple slides with all the questions. And then that concludes our presentation, and we would like to thank our PIs and program coordinators for this opportunity to get engaged in this project, and we would like to open the floor for any questions.
Okay, excellent, excellent. Thank you all. This was Strategy Team 2. And so I'm looking to see, to get a couple questions from YouTube and from Facebook. Okay, we have one question from YouTube. So transition has been an ongoing issue for decades. Outgoing officers often do not prioritize transition either because they don't feel that if their responsibility or they're too busy. So in response to that, what do you think might be the hardest thing or the most difficult thing for incoming regional leaders to do in response to building this transition document for themselves?
I would go ahead.
Oh, you can go.
I would say just to make sure that everybody has the required information that they had when they transition into. It's really hard to be able to have like a seamless process when there's so many moving parts and so many people and paperwork, etc. So just having a streamlined document or streamlined service like your email, Google Docs, Google Drive that has all the required information, and actually use those resources throughout the year in order to not have to find everything when it's time to transition. It's already there in one place.
Another thing that I'll add is that like proper planning prevents poor performance. So we kind of like did all the sort of like planning that you would need to kind of do to transition into whatever role you're in, regardless of whichever region that you're in. The rest of it just kind of lies on the individual to kind of go about reading through the document and sort of actively doing what it tells you to do. And yeah.
Last thing I can add is, changes takes a process, it takes time. So understanding that it would take some time to make those changes and plan ahead of time, right? And just being okay with whatever, questions get thrown out, but also prioritizing how important transition is, because legacy is important and sustainability is. So you're very correct. It's going to be a process. It's going to be challenging to an extent, but it is part of that process to create a smoother legacy and sustainability in the long run.
We have one more question from C. Thomas asking, they were curious to see if you will all will be sharing responses to the transition document when you get them. So can you explain more kind of your expectations for the next strategy team in terms of survey collection?
Yes, so we wanted to compile a list of like all the regional directors and the region emails, and we created a list of questions for them to send out with our transition document that we made attached to it for each region to review, and then they'll answer the questions to the best of their ability and just give their input on what they feel like we left out that pertains to their region or just in the transition process in general. And then from there, they will be able to edit the transition document so we're not missing any details when it comes to the process and make it more like a more seamless process.
Excellent. Thank you all. And then for anyone who's interested in seeing these presentations again and following up with any surveys, FLP will have these documents uploaded onto their shared drive. So if anyone wants, they can email us at flp@snma to request access to that drive. Anyone who has an SNMA email will have can request access to that because we know that a lot of members want follow-up on a lot of this information. But once again, thank you so much, strategy team 2.
Thank you.
Thank you.
Thank you.
Excellent. Okay, hello, strategy team number 3. Okay, I'll let you guys take it away.
Hi, everyone. We are strategy team 3, and today we're presenting on our work about NLI and enhancing institution and student engagement. So first, we'd like to thank our principal investigators for all of their guidance and help throughout this process. So Dr. Darko, Dr. Kulukulani, and Dr. Sanders. And we'd also like to thank Tamika and Safan for all of their help throughout this as well. And then we'll do some quick introductions of our team members. So my name is Rian. I'm a current third-year medical student at Wake Forest School of Medicine. And my current or past SNMA leadership, currently the co-president of the SNMA chapter at Wake Forest School of Medicine, and previously the president and treasurer of the MAPS chapter at Wake Forest.
Good evening, everyone. My name is Deja Murray. I am a third-year medical student at Lincoln Memorial University, the Buss College of Osteopathic Medicine, and I currently serve as Region X Assistant Regional Director.
Hi, everyone. My name is Lisa Felton. I am a graduate of Charles R. Drew University of Medicine and Science, and I currently am the MAPS Health Policy and Legislative Affairs Liaison. Thank you.
Okay, and to start off, we'll talk about the SNMA mission. So Student National Medical Association is committed to supporting current and future underrepresented minority medical students, addressing the needs of underserved communities, and increasing the number of clinically excellent, culturally competent, and socially conscious physicians. So just as an introduction, we'd like to talk about our aims. So our 3 aims are understand how NLI impacts SNMA and its role for future years, the current and future host institution benefits, and overall NLI trends for student engagement. And then we've also broken up our objectives into 3 categories. So starting with the purpose of NLI, we wanted to understand the history and structure of NLI, as well as NLI's purpose and how it's evolved over time. And then we have host institutions. So looking at previous host institutions, the institutional benefits and barriers, as well as attendee benefits and barriers. And then for our future recommendations, we were looking to provide advice to benefit both participants and host institutions, as well as provide a future survey template to distribute to institutions and participants of NLI.
All right, so a little bit about the history and purpose of NLI. NLI first took place in Washington, and it occurred one time a year. The original purpose was for BOD members to meet at SNMA headquarters. This transitioned over time to become more of a leadership development opportunity for members. So for programming, there are various workshops for both pre-medical and medical students, as well as the option to watch BOD sessions. The goal is to develop leadership skills among pre-medical and medical students, as well as increase applications for national, regional, and local leadership positions within SNMA. So here is a list of previous NLI host institutions, with the latest being in January with the University of Memphis. In September, we had Dartmouth Giesel School of Medicine. In January of 2024, Vanderbilt University. September 2023, we had UNC Chapel Hill. And in June of 2022, Washington, D.C. was the last NLI location. So what we see for benefits that the host institution gains is that they can get an increased recruitment of minority pre-medical and medical students at their institution. They also receive institutional recognition on SNMA communication platforms, such as our SNMA newsletter. They can also receive faculty recognition for speaking engagements during workshops, as well as participation in the workshops could be included in the institution's marketing material. Some of the barriers that we see from host institutions is the financial commitment, as these institutions are expected to fully fund the conference, including meals, and we know that that can get pretty expensive, as well as the geographic location and accessibility. Some institutions are a little bit more restricted in transportation, such as an airport being located near institution where individuals can easily fly into that area to attend the conference. So that could be a hindrance to many students coming to those institutions. Some of the student attendee benefits we see is being able to network with SNMA leadership, having a viable alternative to AMEC or their RMEC if they're not able to attend one of those conferences. It also exposes students to different institutional programs, and it increases the knowledge of the structure and leadership of SNMA. Some of the barriers we see with student participation is the limited financial support, as well as travel costs to this conference. NLI's purpose is, we believe, may be underdefined and misunderstood for many students, not really understanding what the difference is between NLI versus AMEC or RMEC, as well as the programming being very similar to other conferences such as AMEC. So really wanting to more define NLI's purpose and have it separated from AMEC so that they're not similar and that they're getting things at NLI that they're not able to get at AMEC.
So future recommendations for NLI is to, one, open registration a little bit earlier. We also recommend publishing the agenda once registration opens. We'd like to incorporate more leadership and team building workshops versus the workshops currently, such as how to apply to medical school, how to write a personal statement. While they're important, we really want to focus on the leadership aspect. And then extending programs that will include Friday evening, Saturday, and Sunday workshops. Additional recommendations we are making is to encourage institutions to apply for grants for additional funding. As previously mentioned, we know that it's a great expense, and perhaps there are grants that are out there that could cover that. Also, we would like to develop a rotation of topics for the schedule that institutional faculty can actually speak on. It's important to diversify the host institutions based on geographic locations to alternate between one coast versus the other in the Midwest. And then to create a data gathering system for tracking pre and post attendance of NLI. And what we also did is we created templates for surveys. So there's one for attendees, and some of those, of course, would include the participant information, um, the expectations, leadership skills, and then the post attendance, again, their reflection, the impact. Did it actually achieve the goal that they wanted? And then we have a similar survey for our host institutions. Again, getting institutional information, their expectation, preparedness for the pre and then the post. Did we live or did it live up to their expectations? What improvements would they like to make in the future? Next slide. So it's important to understand it for the development for NLI of future SMNA leaders in their efforts to improve NLI and begin with centralizing data collection as well as feedback from participants and host institutions, the thing that we found the most challenging. We would like to thank our principal investigators as well as our mentors for their assistance in this project. Thank you. And we will open up for any questions.
Beautiful. Thank you so much, Strategy Team 3. And so we open up for anyone online who wants to ask any questions of Group 3. In the meantime, and anyone or all of your members can answer this, but was there anything particularly difficult when researching this topic? And then how did you as a group or individually seek to overcome that?
I think as a group, what was difficult was finding information. It's not necessarily centralized or easily accessible. And for the team, if they're planning on having a successful NLI, I think it's very important to have past information in a centralized location as well as documenting, for example, how many people registered versus how many people actually attended. That would be very good information to move forth with programming. Looks like one of the questions is, have we considered how we will make the schedule of topics official? I think during the planning stage, once before opening up registration, ensuring that the topics that will be covered are actually solidified, and then creating the agenda so that once registration opens, those who want to register, they can look and say, oh, they're going to be discussing, how to create a budget or how do we submit paperwork. So that would be, I think, very important to have it. So at least you know what's going to be done ahead of time.
Wonderful. And then a follow-up question from Renee asking about HOD approval. Is that a consideration for your team or a concern for these upcoming projects, or is that beyond the scope of the project as of right now?
It's actually something that would be very important. We did not look into it further, but I do believe HOD approval would be necessary in order for it to be something officially done with NLI going forth. So hopefully the next team that works on this project or solidifies a project will be able to do so.
Thank you so much, strategy team number 3. You guys did an excellent job. And then now for everyone, we'll be moving to showcase our national committee. And so we are going to have our national committee co-director, Widlif Bayard, introduce them to get us started. Thank you, Widlif.
Thank you, Safan. Hi, so my name is Widlif Bayard. I had the pleasure of being the National Committee project coordinator for this year. So I worked with some fellows, and we worked also with the national committees of the SNMA, and I coordinated the projects between them. So the fellows they served in various roles within these committees, and they are here to present their final work that they have been working on throughout the year, from creating playbooks to helping establish a pipeline from PMI to MAPS. And I'm so excited to see what they're working on.
Our first fellow, and then Malik, if you could share your presentation.
Hi, everyone. So my name is Michaela.
For clarification for anyone who's just, go ahead.
Hi, everyone. My name is Michaela Davis, and my project was the global.
Michaela, we cannot see your presentation. There you go.
Hi, everyone.
Now we can. Go ahead. Sorry.
Ooh, can you hear me? Hi, everyone. My name is Michaela Davis, and my project was the Global Health Disparities Initiative. So a little bit about me. I graduated from Pierce College last year with my Bachelor's of Arts and Liberal Studies with a concentration in Project Management Administration. This year, I'm graduating with my Master's of Science in Professional Studies, and in the fall, I'm starting on my PhD in Public Health. So I'm currently serving on the NFLP Fellow for the SNMA, and then also their Global Health Fellow as well, and AMEX 2025 Convention Planning Team Committee member as well. And then starting with the SNMA mission and project goals. So the SNMA mission of supporting current and future underrepresented minority medical students and addressing the needs of underserved communities, and then also increasing the number of clinically excellent, culturally competent, and socially conscious physicians aligned with this project, which focuses on training healthcare workers in culturally competency and resource-limited care to ensure more effective service delivery to underserved communities. So the design project goals, equipping fellows with certifications in global health equity and cultural competency through certification programs. So that could be from Yale Global Quality Maternal and Newborn Care, Johns Hopkins Foundations of Health Equity Research Certificate, and then also University of Michigan's Addressing Racial Health Inequity and Healthcare Certificate Specialization. So this really being able to facilitate the completion of either then a research project or individual volunteer work in a hospital or community setting to address those health disparities. And then also 3, to measure success by the number of certifications completed and the impact of research or individual volunteer efforts on an underserved population that the fellows choose. So then starting with the interest, so the fellows will develop expertise in global health equity and cultural competency, and then being able to gain those insights into addressing health disparities in underserved communities. And then training, those fellows being able to complete those certifications and then engage in either a research project or volunteer work, depending which pathway they choose, and being able to apply that knowledge in real world settings. And then follow up. The program will conclude with a final presentation where the fellows are able to showcase their impact and then demonstrating the contributions to advancing health equity. And then the timeline. So phase one, that program design and preparation, finalizing the program structure, and then partnering with those institutions for establishing the certifications and then the volunteer processes for the fellows. And then phase two, that recruitment and enrollment, opening the registration, and then that through the program requirements and then assigning those mentors. And then phase three, the fellows completing their Coursera certifications in global health equity and cultural competency. And then phase four, that research and volunteer engagement. So the fellows engaging in either a research project or volunteer work in hospitals or community settings, being able to address those health disparities. And then that phase five, that impact and evaluation and reporting. So collecting the data on the fellows' progress and their impact on the work that they've been doing with underserved communities. And then that phase six, so that accumulation of everything that they have done. So the fellows being able to present their findings, their insights, their experiences, and being able to really showcase their contributions to health equity and the program's impact. So then action item one, being able to develop a comprehensive program that includes certifications, the volunteer requirements, and then expected outcomes. And then action item two, being able to identify and secure partnerships with those institutions. And then three, creating that registration process for the fellows to sign up for certifications and or that volunteer and research opportunity. And then phase four, being able to provide the fellows with those resources and support. And then phase five, being able to coordinate with those hospitals and community organizations to establish those volunteer opportunities for fellows. And then six, designing that mentorship program to help guide the fellows during their research or volunteer project. And then seven, developing a system track to report the progress of the fellows as they complete their projects. And then eight, setting up regular check-ins or progress meetings for the fellows to discuss their challenges and successes with their mentors. And then nine, being able to establish a method for assessing the impact of the fellows for their research or volunteer work that they choose. And then 10, planning a final evaluation or presentation so that they can, again, showcase their outcomes and impact of the program for all of the fellows. And then cause and effect. So for cause one, equipping the fellows with those certifications in global health equity, and then effect of that, the fellows being able to gain those necessary knowledge and skills to address health disparities so that they're well prepared to contribute to reducing inequities in healthcare systems that they're working in. And then number two, facilitating that completion of research project or individual volunteer work in a hospital or community setting to address those health disparities. And then again, an effect of that, the fellows being able to apply their learned skills in real world settings. And then three, providing opportunities for those fellows to complete a research project or, again, volunteer in healthcare settings that serve underserved populations. And then an effect of that, the research or the volunteer efforts are directly contributing to reducing health disparities. So it's benefiting underserved communities while fostering the fellows and personal professional growth in health equity. And then four, supporting the fellows in completing those research projects or volunteer work in those hospital and community settings. And then again, an effect of that, the fellows' effort in real world environments contributing to tangible improvements in healthcare access, quality, and then particularly again in those under-resourced communities, fostering positive change in health equity. And then some completed action items. So understanding the relevant Coursera certifications for the fellowship that's been identified, again, including Yale, Johns Hopkins, and then again, University of Michigan, and then still working on the logistics of the team research project or potential option of individual volunteer components. And then I attended meetings with my National Future Leadership Program project manager, Caitlin, and then I also attended monthly International Affairs Committee meetings. And then for the future. So current progress and recap, some accomplishments, identified those key certification courses for the fellowship, and then some obstacles, the mentorship and the research volunteer components that are still being developed. And then again, thinking ahead for the future. So coordination of creating those forms to be used for the fellows to track those volunteer work hours if they opted in for volunteer placements in the hospital or community settings, that's still remaining in progress. And then these forms, they'll be designed to capture detailed information, including those dates, locations, hours worked, tasks completed. And then also a digital system that may be considered to streamline submission and tracking, ensuring easy access for fellows and program administrators involved. Then also additionally, those forms that are aligning with the fellowship reporting requirements and provide valuable data to evaluate the impact of those volunteer placements that those fellows are involved in. And then lastly, collaboration with placement sites that's ongoing to ensure those forms meet the documentation needs while remaining user-friendly for the fellows. And then I just want to thank Caitlin, my National Future Leadership Program project manager, who helped so much when I was completing this project. She has been amazing, and I could not be able to do this without her. So now I will leave it open for questions.
Thank you so much. An excellent project. So yes, we open it up to questions and comments. In the meantime, if you had to give this project to another fellow in the future, is there anything specific that you would really encourage them to continue on or pay more attention to with this project?
I would say make sure that they're attending those international affair committee meetings. Those are very important, just so you can gain that knowledge, and just those meetings can really help you as you're progressing through the project. And also looking to see if there's other certifications that are geared towards advancing health equity that could potentially replace one of the ones that I already put in or add to it, I would say as well.
Mm-hmm. Wonderful. Mm-hmm. See. Is there anything from your project that you didn't have the opportunity to share before that you'd like to share with your fellow fellows or anyone watching with us live?
No, I would say everything was that I put in the slides was there, and just really grateful to have had the opportunity to be a part of the fellowship as a whole.
Okay, excellent. Well, thank you so much for your time, and thank you for working on this project. Next, we are going to have Greatness. Actually, Greatness has actually a test scheduled during this time, but thankfully she was willing and able to pre-record her presentation. So we'll play that for you now.
Hello, everyone. This is my project. My name is Greatness Adewumi. I'm a Future Leadership Project Fellow of SNMA. And here today I will be presenting to you my presentation on creating the pipeline of PMI to MAPS. So as I've said before, my name is Greatness. I'm from Houston, Texas. I'm a junior at Baylor University. I'm studying neuroscience. My involvement in SNMA started this past year when I joined the National Future Leadership Project as a fellow, and I was a part of the National MAPS Committee. General leadership I've done is Alpha Lambda Delta. I'm the Social and Service Chair. Honors Residential College, I'm on the Service Committee. FaceTime with God Fellowship, I'm on the worship team, and I'm the founder of the Rare Neurological Disorder Foundation. Fun interests and hobbies I have are painting, singing, dancing, running, and going to the gym. So this is my team. I've worked with them throughout this project, and it has been a delightful experience because they've been by my side through it all. I've worked with Ariana Duckett. She's the Vice Chair of Programmatic Affairs. Jasmine Esther, Pipeline Mentoring Institute Fellow, and Niat, who is the pre-medical board member. So why do we do this? It's because less than 10% of doctors come from underrepresented minority groups. And we felt like that there's an obvious shortage in the amount of doctors who are minorities. And we wanted to increase the number of doctors who are from these underrepresented minority groups. And we realized it really does start from whenever kids are younger, people are younger, because most people from underrepresented minority groups may need more of exposure to these health careers. We also saw that 20% of underrepresented minority students are exposed to health professions at a young age. So granted, that's still small. So we were trying to increase the numbers, but I would say it's a start. And me personally, this project was heartfelt for me because I learned about what a doctor is from a young age. So let's get into the background of the project. So number one, we were trying to resolve these disparities within medicine. So these were the three main points we were trying to look into: passive recruitment and targeted exposure to this field of study for underrepresented minority students. Number two, insufficient preparation of underrepresented minority students for the demanding journey towards career medicine. Three, a lack of comprehensive support systems for students who are already engaged in these pursuits. So we're trying to resolve these disparities through this project. So here's our game plan. We wanted to support MAPS chapters in implementing PMI mentorship programs in local elementary, middle schools, high schools, and their libraries. So we started by taking out an interest form because we wanted to recruit people to start these PMI programs. Then we did a training meeting to train all these people who are interested into starting these PMI programs. And now we're in the follow-up stage, and we just want to ensure that the process is going well for everyone who's involved. So the outcome we're hoping for is that this will set SNMA for success and expose more people from underrepresented minority groups who are younger to the healthcare field and encourage them to pursue these types of careers. So here's a preview of our interest form that we gave out. And this is how we were able to recruit people into the process. Now this is our timeline. This is creating the PMI to MAPS pipeline. Phase one, we had discussions and meetings. So I worked with my team to discuss the general ideas for these projects and see what are our objectives, what are we trying to do, and how are we going to do these things. Phase two, we looked through the handbooks and we're trying to find ways to see how can we update the PMI handbooks for future reference. So me and Jasmine are currently in the process of also updating these PMI handbooks for these MAPS chapters and for the future of SNMA. Phase three, interest. So as explained, we did create an interest form to recruit people into the PMI programming. And then we had phase four, initiation. So we reached out to those prospective participants in PMI programming for an interest meeting. Phase five, training. So we gave them training and we just gave them an overview of the PMI programming process along with the required task. And we also spoke to them about like the history of PMI and how it came about. Now in the future, when we're continuing this, we're planning to edit the handbooks and the outline of this process for future reference of other people starting PMI programs in more chapters. So these are the action items. So we discussed objectives, read through the handbooks, and I gave feedback on them. We created an outline of the PMI programming implementation process. We created an interest form. We created a task list of objectives for the people who were interested in the process. We also attended the MAPS town hall meeting to advertise this event. We reached out to people who were interested. We scheduled the training meeting, and we also have provided additional hours of guidance. So now we are following up with participants in the program. And towards the future again, we want to ensure that everyone is adhering to the rules, regulations, and tasks of the program to ensure that this is a successful process. So here's a preview of the PMI program initiation checklist. So here are some challenges we faced throughout the project. So we had the challenge of communicating with the MAPS chapters presidents, which caused us to have a delay in the project. However, we did continue to reach out to them, and we found other ways to communicate with them through GroupMe and through their personal emails. And through these efforts, we acquired even more responses than originally planned, and we were able to have more participants in this process through this way. So what is our goal? We want to increase the diversity of medical students in order to achieve these several important benefits: improve patient care, reduce health disparities, enhance cultural competency, better communication with patients from diverse backgrounds, and a comprehensive understanding of patient needs, which leads to more effective treatment plans and an improved overall health outcomes. So continuing the project, our project will be continued in the upcoming year to start more PMI programs and additional MAPS chapters. So the purpose of this project was to basically just provide a framework for this pipeline to start. And we hope that in the forthcoming years, more MAPS chapters will have PMI programs that will help alleviate these disparities of minorities in medicine. So I want to thank you for listening, and a special thank you to everyone who made this project possible: Ariana, Jasmine, Niat, and Wildif. If you have any questions, reach out to me through my email. Thank you.
Okay, excellent. So that was Greatness in her recording, wishing her good luck on her exam, even as she takes it right now. Because she's not here present, she's not able to answer questions about her presentation. But for anyone who wants to follow up on or get follow-up information about these presentations, we do have a shared drive where we will be posting all of these. And so if you're interested, you can go there by the link here that I'll share again at the end of all the presentations, or simply email us at flp@snma.org so that your SNMA email can be part of the group that has access to it for further information. And then without further ado, we'll have our next presenter, Frank, present. So I'm going to share him on stage. Hi, Frank.
How's it going? Let me. Alrighty, is it coming through on your end?
Yes, it is. Can you see it? Awesome.
Alrighty. How's everybody doing today? My name is Frank Sheffield. I'll be presenting on the Regional Advocacy Playbook and Training Program that I had the pleasure of developing during my time as a Future Leadership Fellow. And I work directly with the Health Policy and Legislative Affairs Committee to really get this work off the ground. So to start off, just a little bit about me. I was born and raised in Washington, D.C. I recently graduated from Carleton College with my Bachelor of Arts in Chemistry. And my SNMA involvement really stems from my time at Carleton. I had the pleasure of co-founding the MAPS chapter at Carleton and also serving as a treasurer on that board. Right now, I'm also a global health fellow, and I attended AMEC last year, which allowed that all this work in SNMA to continue to be possible and really open my eyes to the opportunity. And for general leadership, I served as mortar board president, and I also was heavily involved within the Black Student Alliance at Carleton College. Just for some of my fun interests and hobbies, basketball and fitness, cooking. I've enjoyed DJing and of course exploring adventurous food languages, and really having the opportunity to really learn as much as possible. So just to introduce my team, I work directly with the co-chairs of the Health Policy and Legislative Affairs Committee. And so I had the absolute pleasure of working with Kaylin Greeter and Adaya Saturki, which were really instrumental in getting this project off the ground. They served as great resources as I was able to really bring this project to success. And so just a little bit of background on the Health Policy and Legislative Affairs Committee. So HPLA is a committee within SNMA really focused on advocacy and policy. It really works to address healthcare disparities and promote healthcare equity, empowering future physicians to engage in legislative affairs. And just a little bit about the structure. Of course, you have your HPLA co-chairs that provide the leadership. You have your vice chairs, which assist. You have your subcommittees, your mentorship and education and communications, your conference planning and finance grants. You also have your policy statements director, which oversee policy publications, and your fellowship program directors, which manages fellows and programs. And on the ground level, you have your regional political advocacy liaisons, which advocate for policy changes locally. And then, of course, you have all your SNMA members, which are general members. And really the focus of the HPLA committee is advocating for systemic change through legislative action and really those grassroots initiatives, and their history and impact have been profound throughout SNMA's history. And so it's truly been an honor to continue to engage in this work and really get involved myself. So why health policy? Through my work, I really think that health policy shapes the quality, accessibility, and affordability of healthcare, really ensuring communities receive the necessary care. It sets guidelines to address public health challenges, promote equity, and improve outcomes. It's so profound that effective policies can safeguard populations while supporting economic stability and healthcare advancement. So with my project itself, I focused on empowering political advocacy liaisons within SNMA to really provide them with the necessary resources, skills, and strategies to effectively advocate for healthcare equity and systemic change. And the outcome is really driving this long-term change at either the local, regional, or national level. And so how do we go from goal to outcome? You can use this as a timeline of a sort of how I really approach the subject. The first step was drafting an advocacy playbook. And we really asked the question there, what tools are essential for advocacy, and how are political advocacy liaisons, how can they implement them, and how have they implemented them in the past? Then piloting the playbook, so really pilot training for the political advocacy liaisons and how they can use the playbook. We want to make sure it's practical and useful. And then lastly is refining the playbook. How can it be refined and published for all regions to use within SNMA and be a continued resource? And so because I don't want to present you with long pages of the playbook itself, I thought to break it down just a little bit about each section of the playbook and sections that I think should be highlighted. And so we start off with chapter 1, which is really developing why advocacy matters, saying how it can shape policy, build relationships, and really drive change. Then chapter 2 goes into that legislative language. Often the key to really communicating with legislators on any level is really knowing the proper communication and proper tactics you can use and really speaking their language. Next, we'll go into a little bit later, legislative advocacy, one of my favorite parts, and really getting into the details of the playbook itself. Chapter 4 is also one of my favorites, hospital collaboration, really emphasizing how we emphasize advocacy and make it into tangible change. And then you have our resource toolkit and the general schedule for national advocacy forums, a tool that SNMA has used for communicating with legislators far beyond my project. And so it's been great to help out. So first and foremost, I want to highlight the legislative advocacy aspect. My goal was to make it straightforward and powerful. So I really had the task of developing scripts, call letters, and meeting requests of streamlining the approach for political advocacy liaisons to really have them have a resource or toolkit that they can lean on to have impactful and consistent communication with legislators. I was able to develop a step-by-step guide. And so often, sometimes you can get lost in the steps of communicating with legislators as policies are getting enacted into change. And so where your advocacy can be most effective was one of the parts that I really wanted to approach. And really streamlining these advocacy efforts and knowing where you can go to get up-to-date, efficient, and advocacy progress on what's going on right now. Another section is the National Advocacy Forums. They're not new. SNMA has used them for a very long time, but I like to think that my approach was making them new and improved. And so I went in and saw really where I could help out. And I think the biggest thing was creating a schedule that allowed them to really stay on track and streamline the process. So I created everything from a one-day schedule to a full weekend forum to really enhance engagement and impact. I was able to specify it by region, and so this can be used right now in times where the regions can focus on specific goals that affect their region. I was able to give them guidelines or details with problems they might want to address, addressing challenges or potential pitfalls of their communication and how advocacy can really work. engaging some key officials, not only appointed officials, but elected officials or wanting to be elected officials who are running at the time can be a key strategy. And then really focusing on state level impact was another part of the advocacy forum that I incorporated. And so really my focus was streamlining communication and having a clear narrative and action plan for these national advocacy forums. But I wanted to go a step further. I wanted to really ask, how can we enhance the effectiveness of our advocacy efforts? And what strategies can we use to drive meaningful, lasting change within healthcare policy? And so one of the ways I thought to do this was really going from advocacy to action, or turning voice into impact. And so one of the ways that I thought about and that I proposed within the playbook is hospital system collaboration. If you can identify key stakeholders, hospital administrators, and patient advocacy groups to really have community health leaders and really have collaborative relationships between them and align your goals, you're able to not only advocate for a need, but demonstrate the need and how SNMA has gone further to help out that mission. And so aligning those mutual goals allows that advocacy to be 100% more effective, because you've not only advocated for a policy, but you've shown and demonstrated a need. And so it makes your advocacy efforts more effective. And just some major challenges that I face personally with engaging with this project is really, my growth as a leader. I really had to balance ambition and realistic goals. This was a big task to develop a whole playbook for regions and on the national and state level. And so it took us to really get a focused and detailed view, to really detail guidelines and not be succumb to the overwhelming pressure of how big just the task can be. Really fostering collaboration. When you talk about piloting the playbook, sometimes that can be hard. Obviously, all the political advocacy liaisons are doing their work on the ground day in and day out, and it's hard to really fit in within that schedule. But luckily, we were able to really get some nice involvement from Region 9 that we're getting feedback from right now to really get this project off the ground and making sure that it has a lasting impact. And then ensuring sustainability, making sure that the playbook can be used long term, and making sure that far beyond my time as a fellow, it can be a resource that individuals can always lean on as they continue their advocacy efforts. And I just want to say thank you to my co-chairs, Caitlin and Adaya, and of course, Widlif, who were instrumental in getting this project off the ground and keeping this project on track. Please feel free to ask any questions in the chat or email me any questions if you have them later. And it was an absolute pleasure to present to you all today. Thank you so much.
Thank you so much, Frank. Eloquently said. So we open it up again for anyone on the Facebook or YouTube to share any questions. I did have a question for you, Frank. Given just how passionately you sound about the project you have, do you have any plans of continuing specifically in this area with SNMA, and how?
Yeah, absolutely. I mean, I think health policy is really something that I wasn't aware of until I really got engaged with SNMA and just how important it can be in a time like today. And so I think it's something that I want to continue to be involved with as I continue my pursuits and hopefully enter medical school this cycle. And so as I continue these efforts, I hope to be in on the ground level, serve as a political advocacy liaison, use my playbook myself, and really implement some of those examples and skills that I was able to preach about. So it's been great to learn about, for sure.
Excellent. And then we have a question from YouTube from Amara. What is something that you are most proud of when working on this project?
Absolutely. I think the thing I'm most proud of is really that last key point I talked about. When you talk about going from advocacy.
Can you still hear me, Frank?
Yes. Can you hear me? Okay, perfect.
Yeah, I can hear you. Go ahead.
Perfect. Yeah. So that last one I talked about, going from advocacy to action and making your advocacy efforts more effective, I think is something that really I was proud of, because it takes advocacy a step further, where you're not only advocating, but you're showing that action behind it, making your advocacy efforts so much more effective. And so I really think that's the key. And in finding those little niches there where you're able to really have a profound impact is really the joy of the game, and allows us to really push meaningful, long lasting and systemic change. And so that's the thing I'm most proud of.
Excellent. And then Dolly in the chat asked, what does regional advocacy look like? Is it more community-based or state level?
I mean, honestly, I would say that's a hard question for sure. It can look like both, and so community-based, at those grassroots efforts, can really demonstrate the need for the community. But of course, at the state level, talking to legislators, being able to enact that change is a key aspect of it. It's how you're able to really get your point across. So it's a mix of both, and both are needed. And so it really depends where you can fit in. But through SNMA, like with the National Advocacy Forums, you're able to get a direct voice and get a direct mission across with legislators who are active on the ground and see those community efforts. And you can even present those to them sometimes. And so it's a little bit of both, but it's a hard question to answer for sure.
Okay. But thank you for answering it. That seems to be all the questions we have for you. Thank you again for your presentation. And we'll bring up the next presenter, Juliana.
Hi.
So, and hi.
Go ahead. Just pulling up my slides now. All right, good to go? You can see them?
Oh, there you go, perfect.
Perfect. All right, hello everyone. My name is Joliana Lequint. I worked with the PMI committee on the ACIP protocol, which stands for Academic and Clinical Excellence in Training. Just a little bit about me. So I originally, grew up in Maryland, and I'm graduating from Meharry Medical College in May. With my MD. So that's exciting, going into residency now. I have been on the MAPS committee for my school's chapter since my first year here, and I've been working with them. And then, of course, being a fellow this year, which has been amazing. Some other leadership experiences that I've had, at least in medical school, I've been co-president of our chapter of the Association of Women Surgeons since 2022. I spent a couple years as the treasurer for the cardiology interest group. And this year, I've also been a co-liaison for the surgery interest group, specifically for subspecialties. A couple of my hobbies: figure skating. I actually have a competition coming up in a couple weeks. Strength training, travel. Also, I have a trip coming up next month, and cooking and baking. So, outside of medicine, I like to keep myself busy. This is my team. The main people that I worked with for this project: Jasmine Easter, who's the Pipeline Mentoring Institute, or PMI, project mentor. And so she was my initial point of contact for this. And then Sydney Young is the PMI coordinator. And she was really the person that I worked most closely with. And we made a lot of decisions about this project together. So the process of becoming a doctor is a long road, and it can be very daunting without guidance. And it has been found that patients feel more secure when their physician has a similar background as them. Therefore, it is important, more now than ever, to increase the diversity of our physician population. The current first-year medical school class is only about 51%. It's 51% white, 32% Asian, 11% Hispanic, and 9% Black. American Indian or Alaska Natives and Native Hawaiian students account for less than 1% each. And when we look at the physician population, only about 5% of doctors in America are Black, compared with 14% in the general population. About 6% of doctors in the US are Hispanic, versus about 20% in the general population. So clearly there's room for much more growth in terms of diversity in our medical community. So with that being said, how do we help change that? As I mentioned, getting into medical school is difficult, as is completing it. And if you don't have guidance, it's just that much more difficult. And not everyone has that guidance. I was lucky enough to have a mother who was a physician growing up. And so I saw that role model and I understood the process. And when I was in high school, my brother was going into medical school. And so I got to see him go through that process as well. But that is not something that everybody has. And so our goal with this project was to create a comprehensive handbook for current and future medical students that would include information and advice about transitioning to medical school, meeting different milestones from M1 to M4 year, navigating medical school successfully as a student of color, and more. So I was very excited to be able to work on this project. Mentorship and guidance for pre-med and medical students is something that I've been very passionate about throughout my medical school career. And as an individual, there's only so much I can do and help. However, with a handbook, there is a resource that can be shared with numerous pre-med and med students to help them on their journey. And so this was just our overall planned timeline for the handbook, beginning with creating the outline and determining the topic list of what needs to be included in the handbook, delegating the tasks of who's going to write which chapters and which sections, going through those first rounds of drafts and edits, final draft review, handbook creation, and then, of course, dissemination is the final goal for the handbook. So as mentioned, the first step for this project was to create the topic list. And when I first got on this project, I just started brainstorming topics I felt should be included in the handbook from my experience as a student. And then after my first meeting with PMI leadership, I was sent a preliminary list that they had from previous years of workshopping this. And so I combined and edited the list to create a complete list of topics that was then confirmed with ACIP protocol leadership. Next, I created an overall medical school timeline to help guide the process and also to be included in the handbook for reference for these students. Then I was tasked with making a chapter template so that the writers for each chapter could have a template to follow so we could keep things as similar as possible with having different writers. Next, we confirmed that timeline. We had a meeting with PMI leadership and confirmed the timeline that we wanted to get all these tasks completed by. We planned out when first draft should be completed, when revisions should be made, and then hopefully when the handbook would be completed and ready for distribution. We had a meeting with all of the writers after that from the various committees who were participating to discuss our vision for the handbook and the planned timeline. We also instructed all the writers to select which chapter that they wanted to write. Then we had a brief meeting with publications to discuss the design for the cover of the handbook. After that, it was time to get down to writing, which is the stage that we're in right now. So first drafts had been submitted end of January, had already gone through the first round of edits and comments for their revisions. Then second drafts were submit mid-March, and we are currently in the process of providing edits and comments to second drafts of those things. Once all the final drafts are complete, we're hoping in April that would be complete. We'll then review the final chapters, determine any final changes that need to be made, if there are any untouched topics that still need to be added to the handbook, and then, of course, create the handbook and disseminate it. So a brief overview of the handbook. Here are the chapters and a few of the subsections. So the book starts with M0, or really that's the pre-med chapter, talking about transitioning to medical school, avoiding burnout, how do you get your letters of recommendation, MCAT prep, those types of things. The first year chapter talking about things like overcoming imposter syndrome and just getting ready to study like a medical student, which is one of the big barriers when you first get in. Then the M3 chapter, obviously talking about those clinical rotations, that is a very important part of medical school. And then fourth year, talking about budgeting for fourth year away rotations, applying and those things, and also transitioning to residency will be a part of that chapter as well. And then a chapter for people who want to do dual degrees, such as MD, PhD, and then a chapter for Caribbean and IMG students and schools. So here's a sample chapter. This is one of the chapters that I worked on. So I wrote or am writing the fourth year chapter, and this is just the first section of the chapter where I talk about budgeting for fourth year. And so kind of our basic outline was a quick introduction to explain what the chapter or section is going to be about, and then jump right into it. And so here you can see I talk about just a broad overview of the various expenses that students can expect in fourth year, so that just kind of going into it at the beginning, they have an idea of the types of things they need to prepare for. So in terms of next steps and obstacles, so as I said, we are working on finishing up feedback and then revisions on second drafts. I also, and I'll get to this in obstacles, but I took on also writing the M3 chapter not too long ago. So I'm working on completing at least the first draft of that. And then, of course, trying to complete the final drafts of the rest of the chapters and hopefully complete the handbook by May if we can. Some of the obstacles that we and I came across in this project were really dealing with miscommunication and an issue with delegation, realizing we didn't handle it as well as we should have at the beginning. It wasn't until we got to the first drafts were coming in and we're doing revisions, we didn't realize that there was some miscommunication on were people writing sections or were they writing full chapters. And so it turned out that when we thought someone was writing an entire chapter, they had only written one section of that chapter. And so that was a moment where I realized, okay, we could have been more clear and made sure that everyone understood what they were doing and also could have checked in. I think, especially with the first draft, if I were to go back and do it again, I would have done a check-in a week or two into, the time that they're supposed to be writing the first draft, just to make sure that everyone understands what they're doing. And so that's how I ended up writing the M3 chapter as well, because we also didn't realize that no one had selected that chapter to be written. And so I just picked that up since I had mostly finished the content for the fourth year chapter at that point. I decided to add that on to my tasks. Well, that's the end of my presentation. Thank you so much for watching, for joining us on YouTube. Special thank you to all the people that helped me with this project, and those are the other people writing on this handbook as well. Please feel free to reach out to me. That's my email there, and happy to answer any questions now.
Thank you so much. Excellent. While we wait for more questions to come in via YouTube or Facebook, one question, given that you focused a lot on you spent most of your time on the M3 chapter, correct?
M4 chapter I spent most of my time on.
M4, yeah, sorry. Yeah. So ideally, what would be the best time you'd want students to receive this specific chapter? Would it be early in their M4 or like their M3?
I'm glad you asked that question. So at least the way I envisioned this handbook is that they would kind of read each chapter kind of midway through. So let's say like for the M4 chapter, this is something that should be read kind of like right after the beginning of third year. Once you've kind of gotten your feet wet with third year and you understand that, start reading that M4 chapter just to get prepared. Because a lot of the chapters are about preparing well in advance so that you can perform as well as you can once you get there. And so that's the expectation, that they would read it prior to, but not too early. Obviously, a fourth year chapter is not useful to a first year med student. Focus on the task at hand. Let's get 1 year down before we start looking too far in advance. But yeah, the expectation is they kind of read it in preparation.
Nice. And then if another fellow were to pick up from this project of yours after you, I guess if you could give one like point of advice for them, what would that be with continuing this project?
I would say that the communication is going to be the main thing. Coordinating the writing of one document across multiple people is difficult. Is one of the things that I've learned, and a useful skill. I mean, that's something that people do. All the textbooks that are written by multiple authors, but it's important that there be a good, strong line of communication. I think I would recommend to them that they make a group chat specifically with all the writers and not just the leadership, because that's what we had. We had that the leadership was communicating, but we weren't properly communicating with the writers. And so that's how we had those miscommunications. So I'd recommend they make some sort of group chat where everyone can ask their questions. You can do a check-in, those types of things.
And then someone asked from the YouTube viewing, how can someone access the document when it's completed?
We are planning on having it be available online, just, to be accessed, simpler than making obviously a physical book, but this would be something that would be available online, like some other SNMA resources.
And FLP will do its best to communicate that moving forward when we get that information. So thank you so much. Oh, we did have one more question. Or at least, they said they really liked this project, and they were wondering, since there are no M2 chapters, would board prep be focused heavily in the M1 chapter?
Yeah. So we decided not to have a dedicated M2 chapter because M1 and M2 year are so similar in that you're just doing preclinical work. with the only exception being, as you mentioned, board prep, step 1, COMLEX. So that would be a subsection within the M1 chapter, just kind of near the end. Okay, here's a specifically M2 things that need to be focused on, but that would be part of the M1 chapter.
Excellent. And thank you to everyone who asked a question. And thank you, Juliana. You are our last presenter for the day. And with that being said, I want to thank all of the fellows, but also I want to officially say that you've all completed FLP. And so you are now all FLP fellow grads. You can clap and congratulate yourselves for that. It's been a wonderful year with you guys. And I have a really quick presentation right before we go to share. Go and rest after your amazing presentations. So again, thank you everyone online and everyone on Facebook, on YouTube for joining with us for our presentations. We are the National Future Leadership Project. And so I just wanted to briefly highlight just pictures of our fellows. Here are our medical fellows. Just that you get just a reminder of who they are, these bright faces, so that when you see them later on throughout SNMA, you remember them for the amazing work they did here and all the amazing work that they are going to continue to do through SNMA. And then here are our pre-medical fellows. Okay. Took some time for them to load. Just wanted you to see their wonderful faces. And you can see more of these slides when we share these slides and all of their project slides, again, on SharePoint for anyone interested. If you are, please email flp@snma.org. But then we also want to give you a view of the SMA leadership. This is the outgoing leadership now. This is my team. They've worked with me to help make the fellows projects possible. You saw Widlith earlier. She was the National Committee Coordinator. Tamika was the strategy team coordinator. I and Charlene were co-directors. Brittany was the program manager, and she maintained communication with the fellows through emails. And Nabila focused on monthly webinars and think tank challenges, honing in the fellows' skills. And Marvell, she focused on development with planning out the mentorship groups. And then just our faces. So as my leadership team is outgoing, keep an eye out for them as well as they go on to other amazing leadership work in SNMA. And then all our fellows and all leadership together. And this is just a reminder for anyone in FLP that applications are open for co-director, for coordinators, and for other fellows. So anyone who's viewing on, if you're interested or you think you know someone at SMA who's interested in being a part of FLP for the next cycle, all of those applications are currently open. And yes, they're currently open. And we'd love to have more people apply and join this big group that we call FLP, and then our leadership team. Okay, so again, thank you all for joining us on this live stream. We know that you could have done many other things, but we're so grateful for that. And I'm again grateful to all of the fellows who present their projects. I'm so proud of them. A lot of the work they did, it was a lot of time consuming, and that was just the projects, not including all of the activities they had to do with think tanks and webinars and meeting with their team. But these are our amazing fellows who finished and completed. And so I just want to give another round of applause to them and thank them again. And so that concludes our live stream. Feel free to like the YouTube, like on Facebook, and again, message us Oh, and then Dolly, you asked, do fellows get to choose their projects? When we do the projects, we do send out a survey to ask the fellows what their interests are. But many of the projects are already dictated by the national committees and these strategy team projects prior. So while they do not get to 100% dictate what projects they do, we try to pair up fellows with projects that closely align with their interest or leadership goals in SNMA. That's a really good question. Thank you, Dolly. Yes. Mm-hmm. Yes. But yes, I will end the live stream. And once again, thank you all. It's been a pleasure. And I hope to see more fellows in the future in the next cycle of FLP. Thank you all. Bye.